In times of crisis, hospitals must be prepared to evacuate swiftly and manage emergencies effectively. This training equips healthcare facilities with the skills needed for safe, rapid, and coordinated responses. Welcome to a comprehensive course on hospital evacuation and crisis response management. Learn structured frameworks for emergency planning and discover who benefits most from this training. CDG training offers global healthcare safety education, providing expert faculty, accredited certification, and practical focus to enhance crisis management skills. Hospitals face unique challenges during emergencies. Ensuring patient safety, operational continuity, and system resilience is crucial for effective crisis preparedness. Understanding the types of hospital emergencies is vital for effective response management. From fires to infrastructure failures, each threat requires specific protocols. Effective evacuation planning involves preparation, training, execution, and review. These steps ensure every patient reaches safety during emergencies. Crisis response teams play a crucial role in emergency management. Each member, from leadership to security, has specific responsibilities to ensure a resilient system. Global healthcare challenges highlight the need for robust emergency plans. From earthquakes to large-scale emergencies, preparedness is key to effective crisis response. Effective communication systems are the backbone of hospital emergency management, ensuring critical information reaches all stakeholders promptly. Patient prioritization during evacuations ensures that those in critical need receive immediate attention, while others are safely guided to safety. Modern smart hospital systems use AI and digital tools to enhance emergency management, ensuring accurate threat detection and efficient response coordination. This course equips you with essential skills in emergency planning, risk assessment, and crisis leadership, ensuring you're prepared for any hospital emergency. Your certification journey with CDG training involves enrolling, completing modules, practical assessments, and receiving a recognized certification to enhance your career. Coordination and decision-making. It ensures a clear chain of authority when every second counts. Effective communication is the backbone of any successful emergency response. Robust systems like public address, alarm systems, and digital alerts ensure coordinated actions across departments. Not all patients can be evacuated the same way during emergencies. A structured prioritization system ensures the most vulnerable receive appropriate support first. Successful hospital evacuation relies on teamwork, communication, and clearly assigned responsibilities. Nurses, doctors, engineers, and security teams all play vital roles in ensuring patient safety. Life support and monitoring systems are essential during emergency patient movement. Portable, battery-powered equipment ensures continuous care even when patients must be relocated. Fire is one of the most common emergencies in healthcare facilities. Early detection and compartmentalization are critical to patient survival. Fear and confusion can increase risks during hospital emergencies. Clear communication, staff leadership, and training are essential for effective emergency management. Regular drills and simulations are the foundation of emergency readiness. Hospitals conducting regular exercises improve response times significantly. Emerging technologies are transforming how hospitals detect, respond to, and manage emergencies. Faster, smarter, and more coordinated crisis responses are now possible. Even well-prepared hospitals face significant obstacles during real emergencies. Understanding these challenges in advance enables better planning and response. The next generation of emergency management will be powered by AI, robotics, and fully integrated digital platforms, transforming crisis response capabilities. Hospital evacuation and crisis response management are essential for protecting patients, staff, and infrastructure. Continuous readiness is a commitment to safety and healthcare professionalism. Explore the various types of hospital emergencies and crisis scenarios, providing a comprehensive guide to understanding, classifying, and preparing for the full spectrum of threats facing modern healthcare facilities. Hospitals operate in unpredictable environments where emergencies can occur suddenly and escalate rapidly. Effective crisis response begins with understanding the different types of threats healthcare facilities may face. Each emergency scenario requires unique evacuation strategies, communication systems, staffing coordination, and operational planning. Hospital emergencies are broadly classified into 4 major categories, each demanding distinct response frameworks and preparedness strategies. Recognizing each category allows hospitals to activate the correct response protocols immediately, minimizing harm and protecting safety. Hospital fires are among the most dangerous healthcare emergencies because patients may not be able to evacuate independently. Common fire sources include electrical faults, oxygen-rich environments, and kitchen fires. High-risk areas such as ICUs and operating theaters require prioritized containment and evacuation strategies to ensure patient protection. A hospital power outage can affect patient safety within seconds, unlike standard commercial buildings where the impact is far less immediate. Loss of life support equipment, communication failure, surgical disruption, and emergency generator activation are critical areas of concern. Natural disasters like earthquakes, floods, hurricanes, and extreme heat events pose significant risks to both patients and staff. Hospitals in disaster-prone regions must use reinforced infrastructure and rapid evacuation protocols to ensure safety and continuity of care. Disease outbreaks place extreme pressure on healthcare systems and emergency operations, demanding rapid adaptation across every department. Managing patient surges, isolation requirements, PPE shortages, and capacity expansion are critical to maintaining effective care during pandemics. Hospitals must be prepared for hazardous material and chemical emergencies, which require immediate containment and decontamination. Key hazard categories include laboratory chemical spills, medical gas leaks, radiation incidents, and biological hazards. Modern hospitals depend heavily on digital systems, making cyberattacks a major operational threat with direct consequences for patient safety. Ransomware attacks, network failures, data breaches, and smart equipment vulnerabilities are key concerns. Threats against healthcare workers from patients, visitors, or external actors require immediate intervention. Hospitals must have clear evacuation and response protocols to ensure safety during workplace violence, armed intruder situations, civil disturbances, and crowd control emergencies. Mass casualty incidents overwhelm normal hospital emergency response capacity, requiring immediate activation of surge protocols and interagency coordination. Transportation accidents, industrial disasters, terror incidents, and community emergencies demand rapid triage and deployment. Hospitals rely on complex infrastructure systems operating continuously 24 hours a day. Any failure can cascade rapidly into a patient safety crisis. HVAC failure, water supply disruption, elevator failure, and oxygen system failure are critical areas of concern. ICU and critical care emergencies require immediate manual intervention and backup system activation. Ventilator failure, monitoring system failure, emergency relocation challenges, and backup equipment activation are critical to patient safety. Operating theaters face critical surgical risks during emergencies, including electrical and oxygen-related hazards, anesthesia equipment failure, sterile environment disruption, and emergency surgery evacuation. Children and newborn patients require specialized emergency evacuation and medical support. Standard adult protocols are insufficient and potentially dangerous in these contexts. Neonatal ICU challenges, pediatric evacuation equipment, emotional support needs, and medication sensitivity are critical considerations. Communication failures during hospital emergencies can be as dangerous as the emergency itself. Incorrect instructions, delayed alerts, and public misinformation compound the crisis at every level. Climate change is reshaping the emergency landscape for hospitals, introducing new threat categories that require updated preparedness frameworks. Heatwaves, wildfires, severe air pollution, and climate migration emergencies demand proactive planning and response. Modern hospital crisis management increasingly focuses on overlapping emergency scenarios rather than isolated events, a critical shift in preparedness philosophy. When multiple emergencies occur simultaneously, resource allocation becomes exponentially more complex and standard single-threat protocols may fail entirely. Hospitals conducting regular emergency drills demonstrated significantly faster response times during real disasters. Preparation is the single most effective intervention. Fire simulations, pandemic exercises, cyberattack simulations, and full-scale disaster drills ensure readiness across all departments. As hospitals become increasingly automated and connected, new categories of emergency threats are emerging that require forward-looking preparedness strategies. AI system failures, smart infrastructure attacks, drone-related security risks, and advanced biological threats challenge traditional emergency response frameworks. This chapter covered emergency classification, specific threat scenarios, specialized department risks, and future preparedness. As taught in CDC Training's Healthcare Emergency Response course, understanding these scenarios is the foundation for effective hospital evacuation planning, emergency resource coordination, and patient safety management.
Explore the core principles of emergency preparedness in healthcare facilities, focusing on building resilient systems to protect patients, staff, and communities. Preparedness is key to saving lives before disaster strikes. Hospitals must act proactively to ensure safety and operational continuity during crises. Emergency preparedness involves planning, training, responding, and improving. This proactive approach helps healthcare facilities manage crises effectively. Emergency preparedness is crucial for hospitals to ensure continuous patient care, support vulnerable populations, fulfill community responsibilities, and meet regulatory requirements. The 4 phases of emergency management, mitigation, preparedness, response, and recovery, form a cycle that ensures hospitals are ready for any crisis. Building a hospital emergency preparedness program involves creating clear policies, defining staff responsibilities, ensuring equipment readiness, and coordinating systems. Hazard vulnerability analysis helps hospitals prioritize risks by assessing internal and external threats, probability, and impact. Effective emergency preparedness requires a coordinated leadership structure with clearly defined roles and responsibilities across all departments. Developing hospital emergency operations plans involves activation, evacuation, communication, and recovery procedures to manage emergencies effectively. Critical care areas require specialized emergency preparedness strategies to ensure patient safety during crises. Emergency communication systems are vital for hospital operations, ensuring rapid and reliable information dissemination during crises. Supply readiness is crucial during emergencies to maintain operations without relying on external supply chains. Regular training transforms emergency plans into practiced capabilities, ensuring staff respond confidently during real crises. Simulation exercises help hospitals test emergency response plans under realistic conditions, identifying gaps before real emergencies occur. Backup systems ensure hospital operations continue even when primary systems fail, highlighting the importance of redundancy. Patient tracking and evacuation readiness are essential for ensuring safety and preventing loss of identity during emergencies. Coordination with external emergency agencies is crucial for effective response during major incidents, ensuring no facility acts in isolation. Psychological preparedness is as important as physical preparedness, ensuring healthcare workers manage stress effectively during emergencies. Emerging technologies enhance hospital emergency preparedness, enabling faster detection and smarter responses to crises. Even the best prepared hospitals face challenges like budget limitations, staff shortages, and communication gaps, but these can be turned into opportunities for growth. Emergency preparedness enables hospitals to respond effectively, protect patients, and recover quickly during crises, integrating various components into a unified system.
Chapter 4 delves into the comprehensive process of identifying, analyzing, and mitigating threats in hospitals before they become emergencies. This ensures the protection of patients, staff, and operations. Hospitals face a wide range of threats daily, from fire hazards to cyber attacks. Identifying these risks early helps healthcare facilities mitigate dangers before they escalate into emergencies. Hospital risk assessment is a structured process that moves from recognizing threats to taking targeted action, ensuring no vulnerability goes unaddressed. This systematic workflow transforms hazard data into actionable plans. Risk assessment is crucial for patient protection, operational continuity, financial stability, and regulatory compliance. It ensures that healthcare facilities can respond effectively to emergencies. Healthcare environments face a broad spectrum of hazards, from natural disasters to technological failures. Understanding each category is the first step toward comprehensive preparedness. Hospitals use hazard vulnerability analysis to evaluate risks and prioritize preparedness efforts. This involves assessing probability, severity, preparedness, and recovery complexity. Hospitals categorize risks by likelihood and severity to prioritize emergency planning resources. This matrix helps allocate resources strategically, addressing the most dangerous and likely threats first. Hospitals face more fire risks than many commercial buildings due to oxygen systems and high medical equipment density. Identifying these risks is crucial for safety. Hospital operations depend on interconnected utility systems. Failure in any area can cascade across the facility, making risk assessment vital for maintaining operations. ICUs require specialized risk evaluation because patients depend on life support systems. Any disruption can be life-threatening, making risk assessment critical. Operating theaters face unique risks, from surgical fires to equipment malfunctions. Identifying these hazards is essential for maintaining safety during procedures. Hospitals must evaluate biological hazards that can spread rapidly, threatening both patients and staff. Systematic assessment and mitigation are crucial. As hospitals become digitized, cyber threats are a growing concern. Identifying vulnerabilities in electronic systems is essential for operational risk management. Climate-related emergencies are increasing, demanding dedicated risk planning. Hospitals must prepare for events like floods and heat waves to ensure patient safety. Hospitals must address security risks, from workplace violence to unauthorized access. Effective risk assessment ensures rapid and coordinated responses. Different patient groups face unique risks during emergencies. Tailored risk identification ensures no vulnerable population is overlooked. Biomedical risk assessment ensures life-critical devices remain operational when needed most. Identifying equipment risks is vital for patient safety. Identifying risks is just the beginning. Effective mitigation transforms vulnerability into resilience through targeted investments and operational improvements. Modern hospitals use cutting-edge technology to move from reactive to predictive risk management, enhancing preparedness and response capabilities. Hospitals face challenges like aging infrastructure and limited budgets. Regular risk assessments help address these issues, ensuring effective risk management. Hospital risk assessment helps facilities recognize threats and implement targeted strategies to transform risks into resilience. This proactive approach saves lives. In this chapter, we explore the critical systems and technologies that ensure hospitals remain coordinated and patients stay safe during crises. Effective communication is the backbone of emergency response, ensuring patient safety and operational efficiency. It reduces chaos and supports leadership decision-making, even in high-pressure situations. Emergency communication in healthcare ensures that all stakeholders receive timely and accurate information, enabling rapid response and informed decision-making. Communication failures can lead to dangerous situations, such as delayed evacuations and increased panic. Ensuring clear communication channels is crucial to prevent these risks. Various systems, like public address and alarm systems, play a crucial role in emergency communication, ensuring timely alerts and coordination across hospital departments. The Hospital Incident Command System (HICS) provides a structured approach to decision-making and resource management during emergencies, ensuring a coordinated response. Each role within the Hospital Incident Command System is vital, from the incident commander to the public information officer, ensuring a comprehensive emergency leadership structure. Emergency command centers are activated to centralize coordination and provide a dedicated space for crisis leadership, ensuring efficient resource allocation and decision-making. During fire emergencies, clear communication ensures rapid evacuation and coordination with fire departments, demonstrating its life-saving potential. Mass casualty incidents require efficient information sharing across teams and agencies, with communication systems playing a critical role in managing resources and coordinating responses. Pandemics challenge communication systems, requiring sustained clarity and compassion to manage multiple emergencies simultaneously and maintain staff confidence. In critical care areas, precise communication is essential to patient survival, requiring seamless coordination among medical staff and accurate equipment status reporting. Effective communication with patients and families during emergencies involves clear announcements, multilingual support, and emotional reassurance to maintain calm and cooperation. Media management during hospital crises involves clear communication with the public, ensuring accurate information dissemination and maintaining the hospital's reputation. Standardized emergency codes allow hospital staff to communicate the nature of an emergency quickly and discreetly, ensuring pre-planned responses without alarming patients or visitors. Advancements in technology are transforming hospital emergency communication, enabling faster alerts, smarter coordination, and more resilient systems. Communication failures during disasters highlight the need for redundancy and robust systems to ensure continuous operation and patient safety. Backup communication systems in healthcare ensure that emergency communication continues even when primary systems fail, maintaining operational continuity. Training staff for emergency communication is essential, involving realistic drills and simulations to ensure readiness and effective response under pressure. Future trends in hospital crisis communication involve AI, immersive technology, and connected devices, transforming how crises are detected, managed, and resolved. Emergency communication and incident command systems are essential for coordinated hospital response, patient safety, and effective crisis management at every scale. Chapter 6 provides a comprehensive guide to safe, organized, and rapid patient movement during healthcare emergencies, ensuring lives are protected while maintaining critical care. In emergencies, a fire can break out unexpectedly, spreading rapidly and requiring swift action. Hospital evacuation planning ensures safe, organized, and rapid movement of patients and staff, maintaining critical healthcare services. Hospital evacuation planning involves organized emergency movement, risk-based decision-making, continuity of care, and coordination and communication. These elements ensure effective evacuation strategies. Evacuating a hospital is complex due to critical care dependency, limited mobility patients, continuous medical treatment, and large facility layouts. Each factor requires careful consideration and planning. Hospital evacuations can be horizontal, vertical, partial, or full, depending on the situation. Each type requires specific strategies to ensure patient safety and continuity of care. During emergencies, hospital leadership must assess severity, patient conditions, infrastructure status, and external support availability to make informed evacuation decisions. An effective evacuation plan includes an emergency command structure, evacuation routes, safe assembly areas, transportation resources, and communication systems to ensure smooth operations. Not all patients can be evacuated the same way. A structured triage approach prioritizes surgical and neonatal, critical care, assisted, and ambulatory patients to ensure safety and efficiency. ICU patients are highly vulnerable during evacuations. Specialized transport teams, portable ventilator support, and emergency medical records access are crucial for their safe relocation. Evacuating newborns and children requires specialized procedures, including incubator transport systems, pediatric medical equipment, and temperature protection to ensure their safety. Operating theater evacuations are technically challenging, requiring management of surgical procedures, sterile environments, medical gas dependency, and emergency surgical decision-making. Primary and secondary exit routes, fire compartment systems, and elevator restrictions are crucial for safe evacuation, ensuring maximum patient throughput and accessibility. Ambulances, wheelchairs, portable medical equipment, and external transportation coordination are essential for effective patient relocation during evacuations. Clear communication through public address announcements, radio coordination, patient tracking systems, and family communication centers is vital for efficient evacuation operations. Managing smoke spread, fire doors, emergency lighting, and firefighter coordination are essential for maintaining safe evacuation routes during emergencies. Regular drills and simulations improve evacuation efficiency, ensuring staff are prepared for real emergencies. Hospitals that practice consistently perform better during actual events. Staff availability, equipment dependency, infrastructure damage, and emotional stress are key challenges during hospital evacuations, requiring solutions like cross-training and mutual aid. Eye monitoring, smart building systems, digital patient tracking, and drone surveillance support modern evacuation management, enhancing safety and efficiency. Coordination with fire departments, EMS services, police, and regional hospitals is crucial for effective evacuation, ensuring comprehensive care and safety for all involved. Autonomous evacuation robots, smart wearable patient tracking, AI predictive systems, and digital twin simulations represent the future of hospital evacuation planning. Hospital evacuation planning and procedures are essential for protecting patients, maintaining healthcare continuity, and reducing risks during emergencies. Successful evacuation depends on 6 key pillars working in concert. In emergencies, patient prioritization and safe transportation are crucial for protecting vulnerable patients. This chapter provides a comprehensive guide to organized, evidence-based evacuation and transport strategies during hospital emergencies and disaster response operations. During a hospital fire emergency, every second counts. Patients must be moved rapidly, with some requiring ventilators or intensive care support. The difference between life and death often rests on how quickly and systematically teams can act. Patient prioritization and safe transportation are critical for preventing chaos and saving lives. Patient prioritization involves a systematic process to ensure immediate evacuation support, balancing medical conditions against environmental dangers. It includes assessing condition, assigning priority, allocating resources, and executing evacuation. This structured approach ensures every patient receives the appropriate level of support during emergencies. Patient prioritization is essential due to limited resources, critical care dependency, time-sensitive emergencies, and the need for operational coordination. It ensures the most critical patients receive support first, maximizing survival outcomes across the entire patient population. Understanding patient dependency levels is crucial for effective evacuation planning. Each category demands a different response strategy and resource allocation, from ambulatory patients to those requiring critical care. Emergency triage systems help prioritize patients quickly, using a universal color-coded framework. Immediate cases require urgent transport, while others can be delayed or monitored. This system ensures that resources are used efficiently during crises. Transporting critical care patients requires specialized teams and equipment to ensure safety and continuity of care. Every piece of equipment must function flawlessly while staff manage stress and maintain focus. ICU evacuation presents significant challenges due to equipment dependency, limited mobility, continuous monitoring requirements, and environmental hazards. These factors create a demanding operational scenario. Neonatal and pediatric patients require specialized equipment and trained personnel during evacuations. Proper training and equipment significantly improve survival outcomes, underscoring the value of preparedness programs. Transporting surgical and anesthesia patients involves unique challenges, such as managing patients under anesthesia and ensuring sterility. Specialized support systems and decision-making are crucial for safe evacuation. The right equipment is essential for effective patient evacuation. Each tool serves a specific patient category and emergency scenario, from wheelchairs to portable ICU systems. Horizontal and vertical evacuations require different strategies. Horizontal is faster and lower risk, while vertical is more complex and suited for critical care patients. Understanding these differences is key to efficient patient movement. Effective communication is vital during patient transportation. Real-time coordination, radio systems, and patient identification systems prevent confusion and ensure safety. Accurate documentation and patient tracking are crucial during evacuations. Electronic health records and evacuation tags ensure continuity of care and prevent errors. Mass casualty incidents push hospital transportation systems to their limits. Surge capacity management, temporary treatment zones, and regional coordination are essential for maintaining patient flow efficiency. Infection control is a critical aspect of emergency transport. Proper PPE usage, isolation procedures, and equipment disinfection prevent contamination and ensure safety. Psychological support during patient movement is crucial for reducing anxiety and ensuring cooperation. Family communication and staff stress management are key components of this support. Technology is transforming emergency patient transport with AI tracking, smart devices, and autonomous robots. These innovations offer real-time visibility and predictive intelligence, enhancing patient safety. Common challenges during patient transportation include staff shortages, infrastructure damage, equipment failure, and communication gaps. Solutions involve cross-training, redundant systems, and mandatory checks. Future trends in emergency patient transportation include smart evacuation beds, drone-assisted supply delivery, AI predictive routing, and integrated hospital platforms. These innovations promise safer, faster, and more efficient patient transport. Patient prioritization and safe transportation are essential for protecting vulnerable patients during emergencies. Key takeaways include the importance of triage systems, communication, specialized equipment, and teamwork. Chapter 8 provides a comprehensive guide to protecting patients, staff, and critical healthcare infrastructure from fire emergencies. It covers prevention, detection, evacuation, and advanced safety systems. A small electrical spark inside a hospital storage room can quickly spread through oxygen-rich areas, creating smoke, panic, and immediate danger for patients and healthcare staff. Fire safety management is one of the most critical components of hospital emergency preparedness because healthcare facilities contain vulnerable patients who cannot self-evacuate, complex infrastructure, and high-risk equipment that accelerate fire spread. Hospitals house a vulnerable patient population, many of whom cannot evacuate independently due to illness, surgery, or life support dependency. Medical gases dramatically increase fire intensity and speed of combustion throughout the facility. Hospitals function 24 hours a day, requiring fire safety systems that never go offline. Large multi-floor facilities with interconnected wings create significant evacuation challenges. Hospital fires can be caused by overloaded circuits and damaged wiring, medical oxygen accelerating fire spread, heat-generating equipment in service areas, improper equipment use, and hazardous materials requiring strict controls. Hospitals naturally contain all three elements of the fire triangle at all times: fuel, oxygen, and heat, making continuous prevention, detection, and suppression systems non-negotiable. Different types of fires can occur in healthcare facilities, including Class A fires involving paper and cloth, Class B fires with flammable liquids, Class C electrical fires, Class D metal-related fires, and kitchen grease fires requiring specialized suppression. High-risk areas in hospitals include intensive care units with high oxygen concentration, operating theaters with anesthesia gases, laboratories with chemical materials, radiology departments with high-powered equipment, and storage areas with combustible supplies. Hospitals employ various fire detection systems, including smoke detectors, heat sensors, flame detectors, and smart AI fire detection, to identify and mitigate fire risks before ignition occurs. Fast and clear communication is essential during hospital fires. Audible alarms, visual alarm systems, voice evacuation systems, and automated emergency notifications ensure rapid coordination across departments and floors. Hospital fire suppression systems must balance effective fire control with the protection of critical medical equipment and sensitive patient care environments. Systems include automatic sprinklers, fire extinguishers, gas suppression, and fire hoses. Compartmentalized hospital design is crucial for containing fire spread within defined zones and providing evacuation routes during emergencies. Systems include fire-rated walls, smoke extraction, pressurized escape routes, and compartmentalized design. Hospitals universally follow the RACE protocol during fire emergencies, a structured framework guiding every staff member's immediate response actions: rescue, alarm, contain, and extinguish or evacuate. The pass technique for fire extinguisher use involves pulling the safety pin, aiming the nozzle, squeezing the handle, and sweeping from side to side to extinguish the fire. Hospital fire evacuation requires carefully balancing rapid patient movement with the maintenance of continuous, uninterrupted patient care throughout the procedure. Procedures include horizontal, vertical, and critical patient evacuation, along with assembly point coordination. Implementing advanced ICU fire suppression systems significantly reduces emergency evacuation risks and improves patient outcomes during fire incidents. High concentrations of medical oxygen, powered medical devices, and surgical fire prevention measures are critical in these areas. During hospital fire emergencies, nurses protect and relocate patients, doctors support critical care decision-making, biomedical engineers manage equipment shutdown, security teams coordinate evacuation routes, and facility teams assist firefighting operations. Repeated fire drills consistently reduce evacuation response times, demonstrating the critical value of regular emergency training programs. Simulations, equipment shutdown drills, communication exercises, and multi-agency simulations are essential components. Hospital fire emergencies present challenges such as smoke inhalation risks, patient dependency, infrastructure damage, and panic and confusion. Regular drills and clear communication protocols are essential to address these challenges. Predictive hazard monitoring systems, smart building automation, IoT smoke monitoring, and digital evacuation guidance enhance fire safety by identifying risks before ignition and providing precise evacuation instructions. Future hospitals will deploy AI, robotics, and fully automated fire protection systems capable of detecting, containing, and suppressing fires with minimal human intervention, dramatically improving patient and staff safety outcomes. Effective hospital fire safety depends on the seamless integration of prevention, detection, communication, evacuation planning, staff training, and continuous emergency preparedness, every element working together to protect lives. Explore a comprehensive guide to hospital preparedness, response coordination, and resilience during natural and environmental crises. Earthquakes, floods, and extreme weather can disrupt hospital operations within minutes, placing patients and infrastructure at risk. Hospitals must remain operational during these crises as communities depend on them most during emergencies. Healthcare systems face a broad spectrum of threats, from sudden geological events to slow-building climate crises, each demanding tailored preparedness strategies. Hospitals cannot stop operations, and any disruption to utilities can threaten patient safety. Limited mobility and infrastructure dependency make patients especially difficult to protect during rapidly evolving disasters. Structural damage, equipment failure, and evacuation challenges are immediate concerns after seismic events. Hospitals in seismic zones often use earthquake-resistant construction to minimize damage. Floods can cause catastrophic failures across hospital departments. Relocating critical equipment to higher floors significantly reduces operational disruption during such events. From alert to recovery, each phase of storm preparedness is crucial. High wind damage and prolonged power outages require immediate and effective response strategies. Smoke infiltration and respiratory patient surges require rapid capacity expansion. Protecting vulnerable populations demands careful evacuation planning and system protection. Prolonged heat waves can lead to cooling system overloads and heat-related illness surges, stressing healthcare systems and compromising patient care. Rapid infection spread and PPE shortages expose healthcare workers to increased risk. Enhanced air filtration and isolation capacity are critical during large-scale outbreaks. Utility failures can cascade into multiple clinical crises, making redundant backup systems essential for operational continuity. Effective disaster response coordination depends heavily on leadership, communication, and rapid decision-making, the three pillars of incident command. Rapid patient prioritization and temporary treatment areas are crucial for managing mass casualties. Hospitals with preparedness plans show significantly improved survival rates. Evacuation requires coordination of helicopters, ambulances, and emergency vehicles to maximize efficiency and safety. Pre-established agreements with regional facilities are essential. Effective communication through public alerts, satellite backups, and social media reduces misinformation and enhances public safety during crises. Stockpiled provisions and fuel reserves ensure sustained operations when external supply chains are disrupted, safeguarding patient care during extended emergencies. Long emergency hours and stress cycles push healthcare workers beyond sustainable limits, increasing errors and reducing care quality. Institutional mental health support is essential. and smart systems provide real-time data and assessments, enhancing hospital readiness and response during disasters. Infrastructure collapse, staff shortages, and resource scarcity are major challenges during large-scale disasters, requiring coordinated efforts to overcome. Climate-resilient hospitals and autonomous emergency systems are future trends in disaster management, enhancing response capabilities and infrastructure resilience. Leadership, communication, evacuation readiness, resource management, and smart technology are the 5 pillars of disaster readiness, essential for effective response. Chapter 10 provides a comprehensive guide to hospital preparedness, infection control, and coordinated emergency response during infectious disease crises. Pandemics can overwhelm hospitals with critically ill patients, exhausted healthcare workers, and supply shortages. Preparedness is essential for effective response. Infectious disease emergencies range from local outbreaks to global pandemics, each requiring a distinct healthcare response. High patient density, continuous human interaction, shared medical equipment, and airborne risks make hospitals high risk during outbreaks. Each pandemic reshapes hospital preparedness, revealing critical gaps and driving improvements in emergency response. Effective pandemic preparedness involves emergency operations, isolation capacity, PPE management, and staff surge planning. Infection prevention systems are the first line of defense during outbreaks, focusing on hygiene, disinfection, isolation, and waste management. Proper PPE selection and use are critical for healthcare workers during infectious disease emergencies, providing essential protection. Advanced isolation infrastructure significantly reduces hospital transmission rates during pandemics. Effective triage systems manage patient surges, protect uninfected individuals, and ensure timely care during outbreaks. Pandemics demand increased ICU capacity, oxygen supply, staffing, and portable ICU expansion to manage surges. Clear communication is vital during pandemics to ensure safety, coordination, and operational effectiveness. Pandemic supply chain management requires real-time tracking, emergency procurement, and strategic resource allocation. Protecting healthcare workers involves shift rotation, exposure monitoring, vaccination, and mental health support. Surge management strategies rapidly expand resources to accommodate patient care during pandemics. Intelligent systems and automation transform hospital responses to infectious disease emergencies. Air management systems are crucial in containing airborne pathogens during pandemics. Pandemics affect mental health across healthcare systems, with long-term impacts on workers, patients, and communities. Pandemics expose vulnerabilities in healthcare operations, highlighting the need for resilient response systems. The future of pandemic response will be defined by intelligent systems, automation, and global connectivity. Managing infectious disease outbreaks requires strong infection control systems, emergency planning, and coordinated healthcare response. Chapter 11 focuses on safeguarding healthcare environments from security threats, violence, and active threats. It provides a comprehensive guide to protect patients, staff, and infrastructure. Hospitals are critical safe zones, especially during crises. This section highlights the importance of readiness in emergency scenarios to ensure uninterrupted care and safety for everyone involved. Healthcare facilities face diverse security threats, from workplace violence to terrorism. Understanding these threats is crucial for developing effective response strategies. Hospitals face unique vulnerabilities due to open access, high-stress environments, and critical infrastructure dependencies. Addressing these vulnerabilities is essential for maintaining safety. Workplace violence in hospitals includes verbal abuse and physical assault. Training and awareness are vital to mitigate these risks and protect healthcare workers. Active threat situations require immediate and coordinated responses. From armed intruders to high-risk areas, preparedness is key to managing these incidents effectively. Conducting thorough security risk assessments helps identify vulnerabilities and enables proactive security planning across hospital facilities. Access control systems are vital for protecting sensitive areas in hospitals. Implementing ID badges, visitor management, and biometric controls enhances security. Advanced surveillance systems are crucial for early threat detection and response, ensuring comprehensive security coverage across healthcare campuses. Standardized emergency codes enable hospitals to communicate threats rapidly and discreetly, ensuring swift action without causing panic. Effective lockdown procedures protect vulnerable patients during emergencies, requiring coordinated action from all hospital departments. The Run-Hide-Fight framework provides clear decision-making guidance for staff during active threat situations, ensuring safety and effective response. Security teams play a crucial role in threat detection, crowd control, and coordination with law enforcement during emergencies, ensuring public safety. Protecting critical infrastructure ensures that life-saving systems remain operational during emergencies, safeguarding patient care and safety. Integrating cybersecurity with physical security enhances protection against digital and physical threats, ensuring comprehensive safety in healthcare environments. Comprehensive training equips healthcare workers with skills to prevent violence and protect themselves and their patients, enhancing overall safety. Mass casualty events require extraordinary security measures to manage crowd control, media presence, and emergency access effectively. Security incidents can have lasting psychological effects on healthcare staff and patients, making psychological recovery support essential. Emerging technologies are transforming hospital security into proactive systems capable of identifying and neutralizing threats effectively. The future of hospital security will be defined by autonomous systems and predictive intelligence, creating a unified protection network. The chapter emphasizes the importance of comprehensive security strategies in healthcare, highlighting the need for training, coordination, and technology integration. Explore the essentials of safeguarding hospital systems and managing utility failures to ensure uninterrupted patient care. Hospitals rely on complex networks of systems that are often invisible but crucial for patient care. Protecting these infrastructures is vital during emergencies. Hospital operations depend on interconnected utility systems, each a potential point of failure. Understanding these systems is crucial for resilience. Utility failures can quickly escalate into healthcare emergencies, affecting life support systems, infection control, and more. Electrical power is vital in hospitals, with multiple layers of backup systems to prevent failures that could threaten lives. Effective power failure management involves preparation and systematic testing to ensure readiness during crises. Medical gas systems are critical for patient care, requiring robust protection and backup strategies to prevent life-threatening failures. Reliable water supply and sanitation are essential for patient treatment and infection control, requiring robust emergency strategies. HVAC systems play a crucial role in infection control and patient comfort, requiring precise management and monitoring. Communication networks are vital for coordinating emergency responses and maintaining hospital operations during crises. Digital infrastructure is as crucial as physical systems in hospitals, requiring robust protection and redundancy to ensure patient safety. ICU infrastructure protection is directly linked to patient survival, requiring redundancy and robust monitoring systems. Natural disasters pose significant risks to hospital infrastructure, requiring resilient designs to ensure safety and continuity. As hospitals become more connected, cybersecurity is as crucial as physical infrastructure protection to prevent operational disruptions. A structured response plan transforms chaos into a managed recovery, protecting patients and ensuring continuity at every stage. Redundancy systems are crucial in hospitals to prevent single points of failure and ensure continuous operation during crises. Biomedical and facility engineers play a vital role in maintaining hospital infrastructure, ensuring safety and operational continuity. Smart technology enhances infrastructure monitoring, enabling proactive maintenance and rapid response to potential failures. Despite advancements, hospitals face persistent challenges in maintaining infrastructure resilience, from aging systems to budget constraints. Future trends in hospital infrastructure focus on smart grid integration, renewable energy, and climate-resilient designs to enhance resilience. Protecting hospital infrastructure is essential for patient safety and operational continuity, requiring a culture of continuous readiness. Chapter 13 delves into how digital crisis management systems and smart emergency technologies are revolutionizing hospital emergency response operations. This includes the integration of artificial intelligence, connected devices, predictive analytics, and real-time communication systems. Modern hospitals are evolving into intelligent healthcare ecosystems. With the help of AI, connected devices, and real-time systems, they enhance emergency response operations. Digital crisis management systems are crucial for improving coordination and protecting patients during emergencies. Digital crisis management connects hospitals, emergency teams, and smart technologies for seamless crisis coordination. It includes real-time monitoring, smart communication systems, data-driven decision-making, and automated emergency responses. Smart emergency management systems enhance hospital operations by reducing response time, improving patient safety, minimizing human error, and optimizing resource management. These systems consistently outperform traditional approaches. A digital hospital emergency system includes an emergency operations center, smart monitoring platforms, digital communication systems, AI decision support tools, and integrated security systems. These components ensure efficient and safe hospital operations. Artificial intelligence plays a crucial role in emergency management by predicting risks, automating alerts, optimizing resources, and providing real-time data analysis. AI systems are indispensable partners in crisis response. Connected medical devices and infrastructure systems create real-time hospital awareness during emergencies, forming a living digital nervous system throughout the facility. This smart hospital ecosystem includes equipment monitoring, environmental sensors, and more. Smart emergency communication systems include mobile alerts, AI voice announcements, digital command dashboards, and multi-agency platforms. These systems ensure seamless communication and coordination during crises. Real-time patient tracking using RFID and smart wristbands reduces confusion during emergencies. It includes digital evacuation mapping, triage integration, and family reunification support, demonstrating the potential of real-time location systems. Smart building automation transforms hospital infrastructure into active emergency response participants. It includes automated fire containment, intelligent lockdown procedures, emergency lighting systems, and HVAC control. Digital twins create virtual replicas of hospitals for emergency simulation and preparedness testing. They allow teams to rehearse disaster responses without real-world risk, optimizing resource planning and infrastructure analysis. Cybersecurity is a frontline emergency management priority. It addresses ransomware threats, data breach risks, connected device vulnerabilities, and ensures emergency communication protection. Drones enhance hospital emergency response by assessing damage, delivering medical supplies, supporting search and rescue, and providing surveillance. They bring defense-grade situational intelligence to civilian healthcare emergencies. Robotics play a vital role in healthcare crisis management by disinfecting, delivering supplies, providing security patrols, and assisting in emergencies. Automation is increasingly important for future healthcare operations. Emergency data analytics provide 100% ICU visibility, outbreak monitoring, AI predictive forecasting, and live staff tracking. These tools ensure the right personnel and resources are always available where needed most. Telemedicine bridges the gap between under-resourced facilities and advanced emergency management. It includes virtual triage systems, specialist teleconsultation, remote monitoring platforms, and regional coordination. Smart emergency training systems use VR, AR, AI simulations, and digital drill analytics to improve staff crisis response performance. These technologies produce measurably better real-world outcomes. Digital crisis management systems face challenges like high technology costs, cybersecurity risks, technical complexity, and dependence on digital infrastructure. Addressing these is crucial for effective implementation. Smart hospitals integrate emergency platforms, autonomous response systems, wearable staff alerts, and predictive disaster prevention. These technologies are key to future-ready hospital ecosystems. Future healthcare emergency technology includes AI crisis prediction engines, 5G communication networks, autonomous medical transport systems, and global connected healthcare networks. These innovations support massive simultaneous data exchanges. Digital crisis management systems enhance hospital preparedness, emergency coordination, patient safety, and operational resilience. They are essential for resilient, intelligent hospital systems under any conditions. In this chapter, we explore the essential strategies for crisis recovery, business continuity, and post-incident evaluation in healthcare settings. These are crucial for restoring operations, supporting staff, and maintaining continuity after emergencies. Recovery efforts must begin even while a crisis is ongoing. Immediate actions are crucial to stabilize operations and ensure patient safety. Planning from the first moments of a crisis is essential for effective recovery. Crisis recovery in healthcare involves 4 interconnected domains: stabilization, restoration, evaluation, and improvement. These domains work together to restore hospital functions and build resilience over time. Business continuity in hospitals ensures that essential services remain uninterrupted. This involves maintaining service continuity, resource availability, communication stability, and supply chain recovery. Recovery planning is critical for hospitals to protect patient safety, ensure financial stability, maintain public trust, and comply with regulations. These elements are vital for effective crisis management. Hospital recovery operations unfold in 4 phases: immediate recovery, short-term recovery, long-term recovery, and continuous improvement. Each phase builds on the last to restore full operational capacity. Emergency damage assessment involves evaluating structural damage, utility systems, equipment status, and environmental hazards. These assessments are crucial for ensuring safety and prioritizing repairs. Restoring critical healthcare services involves prioritizing emergency department operations, ICU and surgical recovery, laboratory and pharmacy restoration, and patient relocation coordination. Infrastructure recovery is the backbone of hospital recovery. It involves restoring electrical systems, medical gas, water and sanitation, and communication systems to ensure safe clinical operations. Managing healthcare staff during recovery involves workforce stabilization, emotional support, shift management, and leadership communication. These elements are essential for maintaining performance and morale. Effective communication after emergencies involves public information updates, family communication systems, media coordination, and community healthcare coordination. These efforts restore public confidence and ensure accurate information dissemination. Business continuity planning ensures hospitals can operate during and after emergencies by identifying critical functions, developing backup strategies, maintaining staffing plans, and supporting remote healthcare. Supply chain recovery involves restoring medical supplies, coordinating vendors, managing transportation, and monitoring inventory. These efforts are crucial for maintaining hospital operations during recovery. Financial recovery after hospital emergencies involves managing insurance and claims, allocating emergency funding, tracking costs, and planning long-term recovery investments. These efforts support financial stability and resilience. Post-incident evaluation transforms crisis experiences into institutional knowledge, preventing future failures. This involves analyzing staffing, equipment, communication, protocols, infrastructure, and supply chain issues. Lessons learned from past disasters improve future emergency performance. This involves updating plans, revising protocols, training staff, and investing in infrastructure improvements. Psychological recovery is crucial for healthcare staff after emergencies. This involves trauma recovery programs, burnout prevention strategies, leadership support, and peer counseling. Technology and digital systems play a vital role in recovery. This includes AI recovery analysis, digital infrastructure monitoring, cloud-based backups, and smart facility management platforms. Challenges during hospital recovery include infrastructure damage, staffing shortages, financial constraints, and public confidence recovery. Understanding these challenges enables more effective strategies. Future trends in healthcare recovery include climate-resilient hospital design, AI-powered recovery coordination, autonomous infrastructure monitoring, and regional smart healthcare networks. These innovations enhance resilience and response capabilities. Crisis recovery, business continuity, and post-incident evaluation are essential for restoring healthcare services and strengthening resilience. The 6 pillars of successful recovery include planning, leadership, communication, infrastructure resilience, staff support, and continuous learning. Explore the future of hospital emergency management with AI, predictive analytics, and smart systems transforming healthcare into resilient ecosystems. Hospitals are evolving with AI, predictive analytics, and robotics, creating resilient healthcare ecosystems. Discover the core insights driving this transformation. From manual systems to autonomous ecosystems, healthcare emergency management has evolved significantly over the decades, embracing digital and smart technologies. AI in emergency management enhances predictive detection, automated alerts, decision support, and resource optimization, significantly improving emergency response. Smart hospitals utilize IOMT, patient tracking, building automation, and integrated dashboards to enhance emergency systems and patient care. Robotics play a crucial role in hospital emergency response, from delivery and evacuation support to security and disinfection, enhancing operational efficiency. Predictive analytics and early warning systems enable hospitals to foresee emergencies, shifting focus from reactive to proactive crisis prevention. Future communication technologies like AI voice systems, wearable devices, and 5G networks enhance emergency coordination and response. Smart evacuation and patient transportation systems optimize routes and tracking, improving safety and efficiency during emergencies. Cybersecurity is a critical priority in healthcare, with smart hospitals facing growing threats. AI defense systems and secure cloud infrastructures are essential. Climate change drives the need for resilient healthcare facilities, focusing on flood-resistant infrastructure, renewable energy, and sustainable systems. Digital twins enable hospitals to simulate emergency scenarios, enhancing preparedness through virtual testing and resource optimization. Telemedicine and remote support systems expand emergency care access, utilizing virtual triage, home monitoring, and regional coordination. Future emergency infrastructure monitoring relies on AI, smart sensors, and real-time management to ensure facility integrity and safety. Future healthcare professionals need skills in AI, cybersecurity, crisis leadership, and technology adaptability to excel in emergency management. Global collaboration and smart networks enhance emergency response through disease monitoring, resource sharing, and data exchange. Smart emergency systems face challenges like data privacy, AI risks, and technology dependence, requiring careful management and adaptation. Future emergency training technologies like VR, AI learning systems, and smart analytics enhance preparedness and response efficiency. Building a resilient smart hospital culture requires continuous readiness, leadership commitment, and staff engagement in emergency systems. Professional certification in healthcare emergency management offers career growth opportunities in smart hospital operations and disaster preparedness. The future of hospital emergency management is shaped by AI, digital skills, crisis leadership, and continuous growth, offering certification opportunities. Enroll in CDG training for professional certification in hospital emergency management, offering flexible online learning and digital certification. Visit CDG Training to enroll and start your certification journey in healthcare emergency management, available 24/7 with recognized certification.